Hello, this video will be about resistant depression, options of treatment. In this station, you are sitting with a patient who is experiencing a change in symptoms of his depressive illness. At the beginning of his illness, he was experiencing difficulty in sleep at night and loss of appetite and lack of energy. Lately, some of those symptoms reversed. He became sleepy most of the daytime, and he put on weight because he is eating too much, and he is lazy most of the time. And this patient is currently on venlafaxine 150 milligram, but he still shows depressive symptoms. And venlafaxine is the second treatment he tried so far. And your task in that station is to inform him about his current condition and how you are going to manage it. And it deserves in that station to start with asking him if he noticed a change in the nature of depressive symptoms he has been experiencing so far. And you can discuss with him that the recent changes in the form of sleepiness, gaining weight, and also presence of constipation, all these symptoms are suggestive for disturbance in the function of the thyroid gland, the gland in front of the neck. For that reason, it's important at first to check the function of his thyroid gland, and if we find that there is a problem in its function, he could be prescribed a treatment for it in the form of thyroid extract, and you hope this will be enough to help him to get rid of those symptoms. But if you find that this is not enough to help him, we can think about his current antidepressant medication, venlafaxine. And be careful, because we didn't reach the maximum dose of venlafaxine, it is not a wise decision to change him or to make switch or even to augment it without trying to increase the dose, especially that the maximum dose could be 375, but only we need to increase the dose to be 225. But you need to inform the patient in this case, he needs to check his pulse, his blood pressure regularly. This is very important. And then you need to tell him, and we hope this will be efficient to help you. But don't worry, if this didn't help, some more options we can depend on. He will ask you, like what, doctor? You can tell him, we can add something which is not antidepressant in itself to your current antidepressant. It can boost its effect. Lithium. And stay silent for a few seconds just to check if he has any queries or questions about lithium. And if he asked you any of them, address them appropriately. And he will ask you anything else. You can tell him, yes, there is a lot of options we still have. You can tell him, beside medications, we can combine this with talk therapy sessions or psychotherapy sessions. And there is a clear and strong evidence that combining both medications and psychotherapy is of great effect, which is much stronger than any of those two types of treatment alone. And let me tell you, don't worry, because we still have other options. And keep silent for 2 or 3 seconds, because your words will make him curious to know what else you still have to help him. If he asked you, what else, doctor, I can receive? If all these lines of treatment fail, he started to be enthusiastic while telling him about the last line of treatment, ECT. By telling him, apart from all what I have mentioned so far, there is still the most effective treatment in the whole psychiatry, including depressive illness, which is electroconvulsive therapy. Have you ever heard about it? If he came across information about ECT, if he told you any concern, try to address it and expect that he will tell you something about its safety. He is believing that it is dangerous type of treatment. Here, you should to be relaxed while telling him, I appreciate your worries, Mr. Smith, and this is usual with most of people to be worried about using electroconvulsive therapy, while electroconvulsive therapy is much safer than what they expect. If I told you that ECT is safe to the extent that it could be used in vulnerable patients like pregnant women and elderly people, does this reassure you that you can try it just if needed? He will tell you, yes, doctor, and here you can close the station by telling him, I hope that I succeeded. Summarize to you the broad lines of treatment, and beside the concise information I provided you about each type of treatments of depression, there are still more information that I can provide you through leaflets, and you are invited at any time to come to see me if this is needed. And thank you.